Hello and welcome everyone to the today's session of failed IVF cycle, how to proceed, brought to you by Apollo Fertility. To talk on this topic today, we have Dr. Garima Sharma, who is our internal consultant with Apollo Fertility. She's a senior infertility specialist working with us. To give a brief background about what a doctor is, she's a sector head for fertility, Apollo Fertility at Thane Center. And about her educational qualification, she's an obs and gynae and have done her DNB and also a fellowship. She's a gold medalist in Fellowship of Reproductive Medicine. So we all are looking forward to hear from you, doctor, because it's a privilege for us to know about this topic from from a person who is well learned in this sector. Actually, a failed IVF cycle is something which many of the couples goes to, and they are really, confused after 2 to 3 cycles of what to do and how to take it from there. So this session is really going to be beneficial to all those couples, and we're looking forward to hear from you, ma'am. It's all yours.
Thank you for that kind words and setting the stage right. I think my topic has got a lot of importance when I look at from an emotional front, when I look at from the physical efforts put in by the couple, and when I look into the scientific aspect of what, as a clinician, I would be doing. So I thought that IVF having an IVF failed and what next. Now this is something a topic which is quite close to my heart because as a clinician at this juncture when I see someone walking down to my door with a negative report and I see yes, that's the point, that's probably a point of an emotional breakdown for many people because we think that that was the last resort of treatment for us. Now, as a doctor, I face the challenges of seeing a couple who's emotionally broken down at this point of time. I see the financial constraints of this couple coming to me because, unfortunately, in India, IVF is still not insurance covered in contrast to our Western counterparts. And thinking about the next cycle or the next steps could be really financially draining for some couples. And as a clinician, what next? What should I really be doing about this? So, when this situation comes that your IVF cycle has failed, it is again a team effort. I always say that, let's go in a staged manner of finding out a solution about how do we move ahead. So, my first thing is always breathe in. That's the day I always say that you have to meet your consultant, talk it out to your consultant. You can obviously have a breakdown, you can have your tears rolling down, that's okay, no one is going to judge you, but that's important because once that feeling or that outburst comes in, then only you would be in a little peaceful mind to understand what could have gone wrong and what is coming our way. So breathe in is something which is equally for me as a clinician sitting out there and as a couple who comes with a negative report. The next is that once you are in an appropriate frame of mind, it is a time for rehomework. So rehomework is that is you're going to relook into your complete papers. That is as a clinician, which I would be doing, and obviously I will be updating it to you. So it's a rehomework between me and my embryologist to look at even those minutest of details where we could have missed onto any parameter or which we could work in our subsequent cycle and improve our pregnancy outcomes. Now, the problem with an IVF also is that although we consider it as the last resort of treatment, it is one of the most advanced reproductive treatment, but the success rates across the globes are still limited to just 50 to 60%. Would it have been 100%? I think we clinicians would have been the happiest people on this planet to give, pregnancy in one go to each and every couple. Now, to reach to that 50, 60%, what do you do next? So, my first thing is that in a situation that your cycle has failed, but you still have embryos, okay? So, how do we go? Now, the problem could be one, the seed. So, the seed is your embryo, which could be the problem with either the egg or the sperm or the soil. Soil is your uterus, which is going to take care of that baby. So that could be the problem. Or third, there could be some other parameters which could have been missed or which could have been now contributing to your negative success rate. So if you have embryos stored and we have to decide your next embryo transfer, so my first thing is that I will obviously relook at your uterus. So relook at the uterus isn't that if we have not done a hysteroscopy earlier, to see that even if there's 1% chance of something which is preventing an implantation or sticking of the embryo to the uterus, I would be more than happy to go ahead, do the hysteroscopy, see the problem, correct it, and come back. Okay. The second situation is that on a hysteroscopy, everything came normal. So now what do we do with the embryos? So if we have embryos of a day three, again talk to your embryologist, look at what is the quality of the embryo. If your lab conditions are good, if your embryos are good, try and extend them to a day 5. That's a blastocyst culture, because a blastocyst always gives you a much better implantation rate than the day 3 transfer. The second is that now you have a blastocyst. So what do you do next? If you are at probably less than 35 and you are having either a day 3 or a blastocyst, now you could think of transferring 2 embryos, not more, of course, because I don't want triplets coming in my way. So you could think of transferring 2 embryos if you have transferred 1 embryo in your previous cycle. The third thing is there are techniques like laser assisted hatching. So, as the name says, that through a very fine laser, you are going to put in some microscopic holes around the outer layer of the embryo. So, to give you an example, like how an egg is, you have a white shell and you have a yolk inside. So, similar is a picture of an embryo. So, for an embryo to implant, the white shell has to break down, and that is how the yolk or that part of the embryo comes and sticks to the uterus and gives rise to a pregnancy. So, in some situations, like where the female age is more than 40, it's a frozen embryo transfer, or you had used a frozen eggs and then you had created the embryos, or you have had an IVF failure in the past. So, on the day of the embryo transfer, again, it is a very skillful technique. So, not everyone would do. You need a very trained embryologist, a good equipment, and a good embryo for all these 3 things. So, your embryologist would put on those microscopic holes and would help in the implantation. The next is that in case you have an advanced stage, this is your probably more than 2 attempts of good embryos failed, or you had done an IVF for a very severe male factor, or you have a history of repeated miscarriages. In those given conditions, you could think of doing a genetic testing of these embryos on a day 5 stage. Okay, but the prerequisite here is that I need embryos for a day 3. तो क्या होता है that the day 3 embryos, we thaw them, we let them grow to a day 5 stage, then we take out some cells and send them for a genetic testing, because we want to see whether it was a genetically abnormal embryo which led to this kind of a failure. The last is that at the time of your luteal phase, तो जो आपको 14 days की medications देते हैं post IVF, you can fine tune your protocol. You can see that progesterone levels were not good, so you could step up your progesterone. If some dosage of the progesterone or some route of the progesterone you were not comfortable, you could change that particular protocol. If your autoimmune profile, or you have a repeated miscarriages, or it is the third time that you are undergoing an IVF failure, then you can think of bringing in some blood thinner injections. So basically what we are trying to do is that before your next set of embryo transfer, we are trying to see what the problem could have been in terms of your uterus or your embryo, and we are trying to fine tune our implantation rates. Now, the second situation comes that you've done an IVF, but we do not have any embryos with us. And now the question comes, what next? Should you be doing something additional before jumping onto the next IVF cycle? Now, again, over here, your homework comes again very important. So, as a clinician, I'm going to look at number one, what protocol did I opt for this couple? Okay. How many eggs did I get from that particular cycle? What was the quality of the eggs? What was the quality of the semen sample? And what was the quality of the embryos that were frozen? Now, before jumping on to doing a next IVF cycle, again, I would be little keen on understanding your uterus. So, as I said earlier, that if your hysteroscopy has not been done earlier, I would do it before jumping to the next cycle. For males, sometimes we see that the semen sample is absolutely normal. over the period of time you have been doing your semen analysis, the report has always been normal. Even on the day of the egg pickup, your semen parameters were fine. But the fertilization, suppose if I had done the ICSI on 8 eggs with good quality eggs, I got just 4 embryos. Then I'm also speculating, is there anything that I'm missing on the male parameter? So now I would subject the male to an advanced sperm function test. That's the DNA fragmentation, wherein I want to know the DNA quality of the sperm and see if that is leading to a little lower quality of embryo. The third thing is that, again, now if this is your multiple IVF failures, or you have had multiple abortions, or you are having a very poor sperm count, or your age is more than 40, then IVF with a pre-implantation genetic testing. That is, before transferring the embryos, I would want to know the genetic status of the embryos, and I am ensure that I would transfer only a genetically normal embryo and not the abnormal embryo. So then, once you are ready to start the IVF cycle, I think bringing in some antioxidants both in your diet as well as in your medications as supplements also fine tune the egg quality and the sperm quality. So we could be obviously thinking of bringing in antioxidants like your in your natural diet, talking about your walnuts, almonds, seeds, a lot of vitamin C. So nowadays it's a season of vitamin C, so which is your lemon family, orange family, bringing in green leafy vegetables as an integral part of the diet, so that I know I can have a little better results. Also, I don't want to immediately jump into an IVF the next month. I would want to give body a gap of about maybe a month or 2 months, wherein all these protocols that I'm trying to bring in, antioxidants, evaluation, they can be done very well. The third, which I would also like to evaluate, that this is specifically if it's the second IVF failed cycle for you. So I would like to also look out for certain blood tests to see if the mother body has certain antibodies which recognizes the baby as an external or as a foreigner, and then she starts, those antibodies starts attacking the pregnancy, leading to either no pregnancy or a miscarriage. So these are simple blood tests, but if these blood tests come out to be positive, then we know very well that the day we see a positive pregnancy test, or maybe even prior, you would probably need blood thinner injections, so which becomes a part and parcel of your pregnancy journey. Now, once I have come to a situation where I'm going to start my IVF cycle, okay? Now, in that given situation, I would automatically change my protocol. That's change my medications to have little more better number of embryos, change my trigger. As I said, I would be more keen on a blastocyst transfer, probably 2 embryo transfers if it was a one transfer at that point of time, and also think of doing a laser assisted hatching. Also, at this point of time when you are evaluating, I would also be little keen on understanding that if you had fibroids earlier which were not close to your uterus, are they increasing in size, or you have anything parameter called as endometriosis, or your tubes have a little fluid accumulation. Because again, before starting a next IVF cycle, all these conditions need to be tackled for you go ahead with the next embryo transfer cycle. So, I always believe that whenever I'm specifically dealing with an IVF failure, one is an empathy, which is required. Second, it's a lot of cross dialogue, which is required between the clinician, embryologist, and the couple. Third is re-revising your notes. See, I don't feel a shame if I have missed onto any particular parameter. All I want is that I need to give pregnancy. So it's about the transparency in your protocols and accepting to fine tune your protocols. The third thing, and most importantly, is that you have to raise that couple. You have to literally build up that emotional or mental stability before the couple can endure for the next journey. So there are a lot of ways wherein we can fine tune and at least reach to that 50 to 60% success rate that I'm looking at. See, before I answer my questions, I would always tell you as couples, where there's a very old saying that where there's a will, there's a way. Yes, it's easier for me to say than for someone who's taking up this journey. But then beautiful destinations, I always say, have sometimes a difficult journey to embark on, but if it's we all hold our hands together, then we always see fruitful results. So I see my chat box flooded with questions, and I think I have a question which says, what care should the couples take before starting a new cycle? Yeah, so this is in general for everyone. What I say now, number one is a mental stability. You have to accept. So you have to be realistic. One is that until and unless you are mentally prepared for this journey, I can't impose a journey on you. If you are not prepared, then the stress is automatically going to have a little lowered impact on my outcomes. So, first is that mental readiness coming from your side. The second is I always give a lot of importance in your my earlier talks. Also, you have seen that every talk I have covered upon the importance of a good diet and a good nourishment, because as an IVF practitioner, I don't look at improvement in success rate from 0% to 100%. For me, even if that's 0% to 5 and 5 to 10 is way too much of an improvement. So therefore, a good nutrition and a good exercise component will always have beneficial impact on your egg quality, sperm quality, your mental status, and automatically reflect in your health sector. The third thing is that if you are facing with some major medical issues, like your diabetes, your hypertension, which could further aggravate during your pregnancy, we need to first settle this before I embark onto the IVF journey. And if you have anything major, surgery spending, you just finish that before you embark onto the IVF. The next important thing, which I always say, obesity. I see obesity as a pandemic, like this is a worldwide affection. So I also see, couples walking down my doors and with, BMI more than 30. And then I always tell them that, I'm so sorry. Yeah. So I always tell them that, it's not about rushing into an IVF and creating babies. It is always about good 9 months. It is about, delivering a healthy mother with a healthy child. So if you are on an obese front, there's going to be a lot of collaborated effort between me, a nutritionist, a physical trainer, and an endocrinologist, so that we come to our desired goals before we start onto this journey. And last of all, I always say yes, we are in a relapse phase of COVID. Remember, COVID is not going anywhere. So whenever you're starting your journey, please don't loosen up your guards. Be still self-protective, because I don't want any infection to set in. With this, someone has asked me, can a female work or should she take bed rest during the gap? Please, there's no concept of a bed rest. I'll tell you, we try and keep this cycle very natural. If I subject some, first of all, scientifically also, it's very well clearly proven now that bed rest is in no way is going to improve your pregnancy outcomes or your implantation. Yes, of course, immediately after an embryo transfer, half an hour to an hour, or some centers even for 2 hours, they would give you the rest. But after that, you can go back and reserve, go and start with your own schedule. The whole idea is that those 15 days are the most stressful days. And if I subject someone to just a bed rest, it's like an empty mind, a devil's mind. You're all that you're doing is just thinking about your results, stress, and then a negative impact. The second thing is when you are keeping on doing your routine activities that keeps you active, improves your blood circulation, and at the end of the day, also improves your pregnancy outcomes. Yes, we say no to certain things. So no to certain things means that, very severe or intense workouts are no. Core strengthening exercises are no. The dumbbell related workouts are no. So if you're doing your conventional, walk, that's completely permissible. I don't even give you the duration, 30 minutes, 1 hour, as per your capacity is good. So we have someone who said, how should they keep themselves with a positive mindset? Is counseling suggested? I'll tell you the importance of counseling. Now, 25th of Jan 2022, Indian government brought IVF under a law. Okay. And one of the prerequisites for all the IVF clinics is that they need to have an in-house counselor. So imagine if a government of India can bring in a law and which cites that as an IVF clinic or as an IVF, center, you need to have counselor. So you can very well imagine how important it is. And when in my practice also, my practice is never about, writing down medications and telling that come tomorrow, take the injections, and this is what we are facing. It's a lot of talk. It's a very emotionally draining journey. So, in terms of strain, I would always say emotional strain more than the physical strain, and then last the financial strain. So, yes, counseling is very important. At Apollo, we have each and every center has its own counselor. Your doctors are your counselors, you have psychological counselors. At every stage, counseling is an integral part, because if my team does not do a hand holding, the journey becomes really difficult. The words become easy to say than really to follow. So counseling, yes, is an integral part of any fertility journey. So I think with this, we are towards the end. I would always say, please do not lose hopes. Yes, it's okay to shed your tears, but what is more important is that the next day you stand up with that courage. It is always a team effort. We will never lose you in, or we will never leave you in this journey alone. We'll always be holding your hands and finding out the ways. There are a lot of ways, as I said. IVF in today's era is all about giving at least one child to one family. That is what is our logo, or that is what is our motto. So on scientific basis, we also keep on updating ourselves, and we also keep on fine tuning ourselves. So my take home message for you all is that, number one, timely identification of your problem, because I see a lot of procrastination also coming from couples. That is, they're engaged, building up their professional careers, and there's absolutely no time for baby thinking. And then when they knock down our doors, they're already on the brink of, limited egg reserve, a lot of factors with the semen parameters, and which we really cannot change. So that's why I always say, you first of all, the journey starts from prioritizing your personal and professional goals. And you should know, if you're delaying your pregnancy, look out for options of embryo freezing or egg freezing. Number two is right time to jump to the next line of management. So every couple is different. It is not like paracetamol fits in for fever for everyone. So one couple might require a very minimal intervention, the second might require an IUI, the third might require an IVF, the fourth might require a third partner, parent, that's a donor kind of a cycle. So what is more important as a couple is that you acknowledge and accept your problem and take the appropriate action. The third thing which is very important is choosing a right center, because a right center with an appropriate facilities, with a good lab, with a good embryologist, is also, it's about 50% of your work comes from there. So choosing a right center is equally important. And last of all, even if we have a failed cycle, because the IVF never gives you 100% success rate, that is not the end of the journey. It is always about fine tuning the protocols. And as I said, if you keep on moving, we will definitely have the success rates. With all this, I wish you all good luck, and I'll be seeing you soon with another interesting topic. If you still have any questions, please feel free to connect on our official website. Thank you and have a very good day.
Thank you, ma'am. Thank you so much for a wonderful session. It was a pleasure and quite interesting session to know on the topic. Thank you.
Thank you so much. Thank you. Bye bye.